More than 2,000 New Zealanders have died as a direct result of Covid-19, or it's been a contributing factor since the pandemic began, but it hasn't killed equally, with Māori and Pasifika peoples and the elderly significantly overrepresented in the death toll. Those who are poor, unvaccinated or with underlying health conditions have and are still at a higher risk. The Public Health Agency analysis examined almost 1,800 deaths between January 1 and August 26. Te Aka Whaiora, the Māori Health Authority Interim Chief Medical Officer Dr. Rawiri McCree-Jansen, no Ngāti Raukawa, predicted these inequities along with some other health experts, and he's with us now. Tēnā koe, Dr. McCree-Jansen, thank you for joining us.
Kia ora, Neil. Thanks for having me.
The elderly, Māori and Pacific peoples are significantly overrepresented in the death toll. This isn't surprising to you though, is it?
It's not surprising. It is disappointing though. Part of it because it was predictable, part of it because we've really given a lot of good efforts from Māori community organisations to do the very best that we can.
When we look at the findings and look back at our Covid-19 response up to now, we seem to fall far short of achieving equity. What better decisions could have been made earlier to help improve these health inequities?
Yeah, equity requires significant interventions across the health system, but also across other parts of the whole of government system. I think housing is a key area. I think income and employment have been really significant contributors for us in terms of the complexity. So if we want equity, we have to be influential across all of those sectors.
And Māori had a mortality risk double to almost 4 times higher than other groups, and in under 60s, Māori accounted for 36% of all deaths from Covid-19. So what are some of the main factors to consider here? Is it just about lower socio-economic status or a lot more?
That's a very significant contributor to it. So, the socio-economic status was a very significant contributor to the differential outcomes. But it's more than that. And so Māori experience of COVID has come on top of the housing crisis. It's come on top of a health service which hasn't met their needs for a long time. That tells us part of the story. If we want a different outcome, then we have to address all of those things.
The findings also showed that vaccinations made a substantial difference across all ethnicities, but one of the areas of concern from the beginning was Māori vaccination rates and the slow rollout of the vaccine response for Māori. Do you expect we'll better deal with these inequities from this point? What lessons have we really learned?
Yeah, so the sequencing of the vaccination for Māori, should have come earlier for younger cohorts of Māori, that's clear. And having said that, the delay also meant that our community was sort of marinated in disinformation and misinformation for many months, and that had a contribution to make. Overall, I think that Māori are very accepting of vaccination, and we've got to keep up with that. That's one of the learnings, is we've got to keep up to date with vaccinations.
And you're talking about now, so it's incredibly important to ensure we're protecting Māori and Pasifika peoples and elderly in this ongoing Covid-19 response.
Yeah, I really appreciate you referring to the ongoing COVID pandemic. It's important that we carry on being up to date with our vaccinations, paying attention to the testing, and if you are positive, whānau, you do need to isolate, and that's 7 days, and that's really important for looking after others in our whānau, in our community.
And it's obviously important to remember this is not over, and it's far from over, even though we can walk about, we can go into shops without masks and so forth. What do we need to do from here to ensure we're still keeping ourselves and our whānau safe?
Yeah, I think we've got to recognise the public health instructions around getting tested if you've got any symptoms, isolating if you are positive. I think masks still have a really important role to play. We should be mindful of the importance of masks in reducing transmission and keeping others safe, and stay up to date with vaccinations. Those are the key messages.
So although masks aren't mandatory, your advice is that we should still probably use them whenever we can.
Yeah, I agree. And, every manae I go to has got lots of masks available. We've still got to support that, make sure that whānau have got access to masks and use them wisely. The COVID numbers will creep back up in weeks to come, and so we've got to stay close to those really important measures.
Te aka whai ora, the Māori Health Authority Interim Chief Medical Officer, Dr. Rawiri McCree-Jensen. Thank you so much for your time today and for the work you're doing. Ngā mihi.
Kia ora.